Hi, my name is Dr. Wellens, and I am here to talk to you about a pretty exciting topic, pediatric foot pain. So I get a lot of parents who ask me questions about their pre-teenagers or teenagers and how come they have heel pain. And for some reason, of course, heel pain being such a common reason why a lot of people limp, automatically a lot of physicians and parents assume that it's plantar fasciitis, which is not true. So I am here to talk to you about calcaneal apophysitis, or it's also called Sever's disease, basically after the physician, Dr. Sever, who first described it. And it's basically not plantar fasciitis. It's an inflammation of a growth plate in a bone called calcaneus, which is a heel bone. And it's very commonly present in active children between the ages of 10 and 13. But I've seen girls as young as 7 or 8, especially my dancers who have it. And sometimes we see them a little bit longer than 13, but usually in boys I see it, and boys who play a lot of sports like baseball, basketball, or even our athletes who do triathlons. I've seen it many times in younger kids as well, but I feel that it's more common in boys than in girls. It can be both heels, but a lot of the times it's just one heel, and I'm going to show you where the most common pain is. It's in the back of the heel right here, and basically there's a growth plate, and this is how our heel bone calcifies. There's like a line on the x-ray that we usually see in our pediatric patients, and then it calcifies and you don't see that line. But what happens is, because that line is still cartilage and the Achilles tendon starts pulling on it, it starts inflaming that growth plate, and it can be a very painful condition. I mean, to the point where kids would limp after the game, and they would have to ice it, they would have to use anti-inflammatory medications. I mean, I've seen severe cases where I would have to immobilize patients and put them in a walking boot. I've actually casted a couple of my pediatric patients, and they were in a wheelchair for 6 weeks just because of how extreme and excruciating the pain was. Please know that this is an injury, it's not a disease, so it is very treatable and very curable. But of course, you want to see a specialist like me. You want to see somebody just to be sure it's nothing else, because I have seen multiple cases of partial Achilles tendon tears, and you guys watched my videos on that, in pediatric patients, and they were automatically written off as Sever's disease or calcaneal apophysitis. So they were basically misdiagnosed, and parents could not understand how come the children were not getting better and were getting worse. And so of course you want to be sure it's an accurate diagnosis. So the treatments are what we used as pneumonic RICE, which is rest ice compression elevation, over-the-counter Advil, ibuprofen. But we utilize orthotics as probably the most common treatment protocol, and it's basically an orthopedic arch support that will help biomechanically to stabilize the Achilles tendon, and it's something that goes inside of the shoe, and usually our young athletes would wear them in their cleats or the shoes that they wear to play soccer or tennis, and usually that resolves the problem within 6 to 8 weeks. Occasionally, I would order an MRI just to be sure there's nothing unusual going on, because sometimes we do see unusual things. But most of the time that would resolve it. The biggest issue, of course, with our young athletes is because they're still growing, orthotics will need to be replaced every 18 to 24 months, which is not bad, because considering the fact that they are back into the game, being active instead of being immobilized, in a cast. I mean, who wants to put their child in a cast for 6 to 8 weeks? That's not probably one of the things as a parent I would consider as a first line of treatment. So if you have a son or a grandson or a granddaughter who's suffering with heel pain and it's not going away, and something that you want to be aware that calcaneal apophysitis or Sever's disease is very real. I probably see half a dozen of pediatric patients a week in my office with that. So call us. We are specialists. We know exactly how to fix it. So do not hesitate to schedule an appointment.